Good morning, Miss Ginger. Hi, my name is Carlos Pena, and I am one of the medical technicians here at Denton Regional Medical Center. I know you may feel a bit uneasy about your prognosis and the surgery, but know that we have the best doctors in the business for your procedure. This procedure is very common, so breathe, relax, and know that everything's going to be okay, alright? The doctor will be doing a procedure called the Mohs surgery, which has been used a lot more often in the recent years due to an increase in patients with skin-related growths, such as yours. These skin-related growths can be either the basal cell carcinoma or the squamous cell carcinoma. The reason why this surgery is being performed is because it causes minimal damage to the healthy skin cells. You do not have to worry about there being a hole in your face because with this surgery, every layer of skin that is cut into is examined for any cancerous tissue. If there is no cancer, then they finish the procedure, or they continually marginally remove more skin. They continue this procedure until all margins around the surgery area are cancer-free. Now, the condition that you have is called basal cell carcinoma. This is one of the most common forms of skin cancer that happens on the lower part of the epidermis or outer layer of skin. It is a condition that is caused by overexposure to the sun. It says here in your charts that you grew up near the beach. I'm sure you had a lot of fun at the beach when you were young. But over the time, the intensity of the sun caused your skin cells to react into the condition you have now. It can be hereditary, but it is also common amongst people with fair skin, blue, green, or gray eyes, or red or blonde hair. This may be the case for you. Now, Dr. Dallas will be performing the surgery for you. He has been in the medical field for 20 years and has worked as a surgical oncologist for over 10 years, so you're in good hands. He studied pathology while in medical school because he found diseases fascinating, so know that he will take every measure of care with you when doing the procedure. The doctor is going to examine the middle of your zygomatic bone, which is your cheek, so he can see what needs to be worked on and look at the symptoms that you have. Anesthesia will be used to numb the area so you feel no pain. Just as I explained before, he will look at every layer of tissue during the procedure to see if he is getting everything out. Notes will be taken and he will diagnose whether he needs to remove some more or if nothing needs to be removed at all. Only a scalpel will be used for the procedure, so do not worry about any loud, scary noises from any scary machines because he'll just take the scalpel and lightly remove every layer of the cancer until there's nothing left. Now, the biopsy of the tissue in between the procedures may take a while, about 30 minutes probably, so a band will be placed over your skin in order to keep it clean while he's making his diagnosis. I cannot really tell you the exact amount of time the procedure will take, but the procedure will be about 1 to 3 hours probably, depending on how much needs to be removed. Also keep in mind that the doctor will be doing the biopsy and may have to go in again to make an incision if he did not clear everything out the first time. There is a small risk of scarring, but if you take care of the wound after the procedure, minimal scarring will occur. It will take about 4 to 6 weeks for the healing process to occur. Just give it time and keep the area clean. I cannot express how important it is to keep the wound clean. Make sure to gently wipe the area every day so that it does not lead into an infection. Also, stay out of the sun for long periods of time since the skin will be sensitive. Use fresh bandages every day and try not to stretch the skin so that the stitches stay intact. Good afternoon, Miss Ginger. I see that your procedure went well as planned. I told you that you didn't have to worry about anything. Now, the stitches that you have will need to be removed in about 4 to 6 weeks, depending on how your healing process goes. When would be a good time for you to come in? Okay. All right. That will work. Make sure to keep the area clean so that an infection won't happen, and try your best to stay out the sun, as I said before. If you have any questions or concerns about anything, we're only a call away. Or if you'd like, you can ask your local dermatologist. All right? I'll see you at your next visit. Enjoy the rest of your day.